Hello, I'm Ron Roel, the host of 45 Forward. Today, I'm joined by Greg Olson, the director of the New York State Office for the Aging, an agency that provides services for more than 4.6 million older New Yorkers and focused on helping them live independently with dignity for as long as possible. Greg has been a leading voice in the aging policy sphere for many years, and now he's helping to drive one of the most ambitious efforts in the country, New York's Master Plan for Aging. It's a sweeping initiative shaped by hundreds of stakeholders, more than 100 proposals across areas like caregiving, housing access, health and wellness, home care, social engagement, and community design. Today we'll talk about how the plan came together, what it aims to achieve, and what it means for older adults, families, and caregivers, not just in New York, but as a model for what we need to do for families all across the nation. So, Greg, welcome to the show.
Thanks so much for having me, Ron. I appreciate it.
You're quite welcome. So I will just say that one of the things that interests me in particular is that I was involved in the master plan as one of the participants, involved in one of the stakeholders groups, so I was part of the process, and I'm delighted to be part of the outcome. It came recently, and at the end of last year, I guess the report came out. It's a very comprehensive report. At the end of the show, we'll tell people how they get a hold of it and learn more about it. But why don't we dive right into, how this came about, how you engage the public and private sector and stakeholders, and what we have in terms of the outcome.
Yeah, thanks, Ron. And I'm happy to talk about that. I think the first thing that I'm going to say is the MPA is not the beginning. It's really a continuation of work that we've been doing for quite some time. So long before there was a term, whether it be multi-sector plan or master plan for aging, long before there was anything called age-friendly communities. I worked in the legislature and I passed a couple of bills to really start the process of livable communities, and that was really back in 2005. So we've been at this a really long time. We became the first. So we created something called Livable New York, and the concepts are really the same, right? So whether it be elements of livable communities, smart growth, those types of things. Like I said, we've been working on these types of things, multi-agency, going back to 2007. We created something, we kind of branded our own called Livable New York, and that's really the precursor to age friendly. We became the first age friendly state in 2018, and myself and a couple others had written the executive order that created that, had established a process very similar to the MPA. But now what you have is a new governor, and there are efforts around the country, particularly like Colorado, California, that were maybe I don't know, a year ahead of us in terms of that terminology. So, Governor Hochul had written an executive order to really create the MPA. And, I think a couple of different reasons. It helps us really, I don't want to say we made a lot of mistakes, but it helps us be a little bit more correct some of the things that we didn't do under age friendly. And so, it was a long process. The executive order came out in 2023, November. And, you had to go through an organizational process. Which state agencies do you want involved? How do you engage stakeholders, et cetera, et cetera? So, as you mentioned, 18 months later, June 25, the first iteration of the MPA came out. And as you said, we did a lot to engage the public because this isn't about the New York State Office for Aging, the Department of State, or the Health Department, or anybody else writing this. This was about organizing a large group of professionals, individuals, advocacy organizations, businesses, to actually provide recommendations from the people based on what it is that they do every day that they know will make life better for older adults. So we had, you know, 20 public listening sessions, over 430 stakeholders, 800 meetings. We had a council of state agencies, a stakeholder advisory committee, 8 subcommittees, 34 work groups, and 10 industry roundtables. And on top of that, we did two different surveys for older adults, and that reached 40,000 people to really ask them how they feel about themselves, their communities, their places to live, their access to housing, transportation, work, social engagement, things like that, which all fit into not only the principles of age-friendly communities, but our pillars under the master plan.
Yeah, one of the things that impressed me is that I've been very involved in aging issues for a while. I'm now in the ARP New York's Executive Council. So aging is an important subject for me, and recently one particular aspect I've been involved with is caregiving, and I came out with a caregiving navigator guide for Long Islanders where I live. And one of the things that people say, well, why are you doing this guide? People just they deal with caregiving as crises come up and they deal with it. And my response is that's exactly the wrong way to deal with it. And I feel the same way about aging in general. And that's why people just we all age, but we age differently. But we need a plan, and we need to think about it in a comprehensive way, not just let it happen to us. So I was really gratified that you guys did this.
Well, I'm 100% behind you. So we could talk about caregiving all day. We have a huge caregiver portfolio. Um, but I think what we have to do before we do anything on aging is actually talk about who's actually aging. Because in this culture, in the United States of America, we've all grown up for a couple of hundred years and being told directly and indirectly, because we're an anti aging society, that older adults are frail, they're expensive, they're takers, they don't contribute. That could not be more of a falsehood. So, it's very easy for me as an agency head to tell you what we do. I could tell you how we do it, but we never ask the question why. And that's what the MPA really starts with is look, whether you're on Long Island or you're up in Plattsburgh, you're on the southern tier, older adults in New York State are an economic, social, and intellectual powerhouse. They pay 40% of all state and local taxes, $72 billion a year. They're the number one givers to charity, philanthropy. They're the number one entrepreneur group. They're the number one volunteer block. Their work and GDP is 47% of the state at $730 billion. They have huge home ownership rates, so they're paying, again, locally for schools, they're paying for Medicaid, they're paying for other things. And I could go on and on with the data and what the contributions are. And so, why do we talk about that? Because we want older adults to stay in New York. We want those contributions to stay in New York. And if we develop a plan on how to keep people healthy, help them improve, stay engaged, if they want to go back to work, go back to work. Um, we can do those types of things. And then we know that there is a whole community based infrastructure that can help people if and when they need help stay in their homes and communities, which is where over 90% of people.
Yeah, yeah. I think that people. You mentioned the notion of the perception that older people are takers rather than givers, and I couldn't agree more that and especially as we live longer and longer and are staying more and more vital, what older people are giving, and of course, it's like, well, who's older exactly? I mean, now when I'm on the last quartile of life, but it seems to me like 60 is like that's pretty young.
It really depends. So, when people want to move the Social Security age or redefine aging, I am adamantly opposed to that. And I'll tell you why. Because you could have somebody that works in a white collar job like me, right? Where my 75 or 80 is going to be very different than my brother who is a professional landscaper. And when he's 61, his body's broke down. If you're an ethnic or cultural minority or you're doing service and other types of jobs, there is no one brush you can paint for older adults. And unfortunately, that is what we do. We don't paint children as all of them are autistic. We don't say that everybody middle age, pick whatever it is you want to say, but we absolutely do that with older people. And, I've been doing this work, Ron, for 35 years. And the number one thing that I do, doesn't matter what the topic is, to talk about the value of this population, what they give back to families. We have almost 200,000 grandparents who are the primary caregivers of grandkids. We have almost 1 million volunteers providing 500,000,000 hours of service to over 30,000 not-for-profits at an economic value of $13.2 billion. like I said, you wouldn't have a local, regional, state, or national economy without them. Many are prepared and are going to work into their mid to late 70s because, again, you do live longer, and a lot of people's economic security and social support systems come from their jobs. I mean, what's the first thing somebody says to you when you run into them if you're working? What do you do? What do you do for a living, right? We are so we put so much emphasis and focus on our work and our jobs that's how a lot of us identify ourselves is by what we do. Now, when people ask me that question, I say I'm a dad because that's what I do.
Right. Yeah, I think also one of the things that frustrates me too is the lack of realization of well, as we get older, we're not necessarily frail, but there are times when we need assistance, help staying in the home. And so one of the things that I like to use the term, and I'm sure you do too, is investing in our older population. So one of the figures I've heard, maybe you've heard other figures as well, but in terms of keeping people in their homes, um, you know, something like a $15 million investment in home and community-based services basically generates $50 million in savings for Medicaid, of helping keep people out of assisted living or nursing homes. But we don't think in those terms.
I'm glad you raised that because that's my analysis that you're citing right there. And you're absolutely right. So, for your listeners, when we say home and community based services, they may not know what that means. Most people think of, when you talk about services for older people, you mentioned assisted living. They might think of that, especially on Long Island. I used to work for an assemblyman from Long Island, and I was part of drafting the assisted living reform bill in 2005 because they were cropping up mostly on Long Island, but they're not for everybody. You have to be very wealthy in order to access assisted living. It's not available to the overwhelming majority of people in the state of New York. They know maybe about adult homes, they know about nursing homes. That's not what we're talking about, Ron. What we're talking about are services in the home and community that we can provide at anywhere between 1/10 to 1/17 the cost of nursing home placement. And that can be anything from delivering a meal in the home. We oversee the largest nutrition program in the country, providing 22 million meals a year to 260,000 people. It could be transportation to dialysis. It could be transportation to a community event or, to go grocery shopping. We also have an in-home program where we can send, and we send aides into the home for people to, if they need help with bathing, dressing, cooking, shopping, etc. So many of our clients that are receiving those more intensive services are actually eligible for nursing home placement right now, but they don't, that's not the first line of defense. And we're able to serve them for 5 to 7 years and provide a whole bunch of additional wraparound services for under $10,000 a year, where the average nursing home cost on Long Island is $178,000 a year. So, for your listeners, when we're talking about home and community based services, that's what we're talking about. And it's not always just Medicaid. None of our services are Medicaid funded. They're funded by federal dollars, much more state dollars, and then municipalities like Suffolk and Nassau County provide additional resources as well.
Right. So let's just, we mentioned briefly caregiving before, but let's take a deeper dive because this is something that, you guys really seem to get. I've listened to a number of programs you've had about family caregivers, and you understand this sort of, well, for lack of a better word, a public-private partnership you have with the private sector and how much unpaid family caregivers help the state in terms of keeping people in their homes and to keep people wherever they are. So talk about your philosophy about that, because to me it's a pragmatic one, but it's also an ethical and moral one that you guys really seem to understand.
Yeah, and it's thanks, Ron. And it's complicated. So again, for your listeners, the industry term is caregiver. What we're really talking about is any family, friend, or neighbor that is providing some level of uncompensated care to somebody else. And it could be me providing care to my parents, it could be spouses providing care, it could be a neighbor, a friend, children caring for an older adult. a middle-aged individual caring for a younger person that might have a disability. So again, it's not an age thing, but many of them are older, obviously. In the state of New York, we have 4.1 million people who are providing uncompensated care every day. And if you had to pay for that at the market rate, it would cost $39 billion, and it would mostly be from Medicaid. And then what funds Medicaid? Local property taxes and state general fund revenue. I mean, education and Medicaid are the top two things that the state budget pays for. Um, the reason I don't like to use the word caregiver, Ron, is because 55% of people that are providing care to somebody else don't consider themselves caregivers. They consider themselves spouses, daughters, sons, etc. And so you're right. We focus a lot of time on. I've been somebody that's provided respite to families with Alzheimer's or Parkinson's disease. I am a caregiver for both of my parents. Um, and there's a lot of us out there, but people think that they're alone. But it can get very, very complicated. Culturally, there are certain cultures where the expectation is you absolutely take care of your family. They're not going to a nursing home. There's other issues where family dynamics are really difficult. Not all families get along. And that can become very difficult if somebody finds themselves in a caregiving role. But you talked about public private partnerships. I have over 30 public private partnerships with technology companies, and two of them are in caregiver space, meaning that any caregiver in the state of New York can access those resources for free by simply going to our website at aging.ny.gov.
Yeah, so I appreciate that, and actually, when I started working on my guide, some people say, well, caregivers, people don't think of themselves precisely as you said. I said, I know, but that's what they are, But when we were parents, we were caregivers. I think the term is okay with me, in the sense that it basically it expands the spectrum because when our children are young, we're parents. When we're older, we're taking care of our parents, and we have different roles. But I think what I like is that you guys get past the term and you just deal with the service. What do people need? And it's tricky. It's difficult because, as you said, not only do we all age differently, but people's needs are different and every family is different. So I think you do a pretty good job trying to figure out how you can provide a flexible enough system of services, while recognizing that there are just things that families need to figure out for themselves.
Right, and it's going to be different for everybody. And to your point, Ron, I don't dislike the word caregiver either, but the reason I don't use it is because if we use it, a caregiver will not consider themselves that and you lose them. You can't provide the service. So what we've done is we've developed a very short video that focuses on tasks. What are you actually doing for somebody? And then at the end, you can say you're a caregiver. And guess what, Ron? When you do that and you focus on the task, you can increase somebody's recognition that they're a caregiver by 450%. And that's where the gold is because, again, people think that, and a lot of times it's true. You might have a conversation with your spouse if you're older, and these are really difficult conversations. And one spouse might say, whatever you do, please don't send me to a nursing home. Same conversations with kids. That's like people's number one fear is losing their independence, and I get that. But you're right. So everybody's journey is going to be different. So I'm gonna talk about direct services that we provide to help the caregiver. And those could be things like we call it's called respite. And it just means if you need a break, could be for a couple of hours so that you could go shopping or read a book or go visit a friend. It could be for a full day, like going to a social model adult day where you're dropping a loved one off and you know that they're safe and they're going to interact with other people, get a nutritious meal. Weekends, short term and longer term respite to give that person a break. We have support groups for caregivers so that they can talk to other people that have similar experiences, just so they know that they're not alone. And you get that peer support. There's, there's training and education for a caregiver on, how to do their job better, how to lift, how to get somebody out of bed, those types of things. Where the real gold is, though, is on what I call the indirect side. It's the things that take the tasks off of the caregiver: transportation, home delivered meals, shopping assistance, social adult day, personal care, helping with bill paying and financing. So you put those two things together, and if you can reduce the hours or the intensity of what the caregiver is doing by having us provide those services to them, it makes their job a lot easier. So there's two things people can write down. One is called the New York Caregiver Portal, powered by Trualta. It's on our website, as I said, aging.ny.gov. That's an evidence-based platform that can help, depending on who a person is caring for, do a better job, get online support groups. And what we know from people that use it is they have a 20% reduction in hospitalizations because they're doing their job better, and a 15-month delay in nursing home placement. Yep. The other is called the Caregiver Intensity Index by Archangel. It is also free for anybody. It takes 2 minutes, um, 24 questions, and will tell you where you are in your caregiver journey. Green, I'm good. Yellow, there's some problems. Red, I'm in crisis. It will tell you what are those things that are driving your stress, what are those things that are supporting you. And then both of them connect to not only services we provide, but a lot of other services that are available for people.
So just repeat them again, Greg. They're both on your website, right? But what are the two
Yep.
links?
Aging.ny.gov will get you to the
Right,
main page, and
right.
then you'll see help for caregivers. The
Okay,
first one, free for all your listeners, I pay for it. It's called
okay,
the Caregiver New York Caregiver Portal, powered by
okay.
Trualta. The name is Trualta, but nobody knows what that is, so I call it the New
Right.
York Caregiver Portal. The second is what's called the Caregiver Intensity Index. They are literally right next to each other. Our website is very easy to navigate. But again, we have a lot of free resources for people through some of our tech. Like I said, I've got over 30 public-private partnerships. We're serving 2 million more people using technology because older adults use technology at the same rate as everybody else. Again, another thing, Ron, that you're helping us with is to combat ageism and stereotypes, right? Older adults use tech at the same rate as everybody else. We live in a tech society. And so if we can help folks by, building upon what we already do to serve more people, that's what we're going to do.
So going forward, Greg, what do you see as some of your biggest challenges? I mean, some of the things I look at is we it's important that we keep people independent in their homes as long as possible, as long as they can. But then, of course, there are issues of social isolation and mobility, which are important, issues as we get older. So, what are we doing in those spheres?
Yeah, so I would say that there's a couple of things that have been around for a while and are not going away. Number one is, investments in the New York State Office for Aging so that we can continue to expand services as the population grows older. And I do have to give Governor Hochul, well, I give her a lot of credit on a lot of things, but she put the largest investment in my agency in New York State history last year, and it's in the out year financial plan this year. That's helpful. Transportation is a huge issue. 95% of the state's geography has no public transportation. Public transportation assumes you can use it, you know how to use it, and you can afford it. So I think things like automated cars. I was just in Atlanta yesterday, and they're one of 10 cities that have driverless cars. That is going to be a very important solution for us. Affordability. That is Governor Hochul has been talking about affordability for 4.5 years, and rightly so. Everything is going up. Gas is up $1.20. Food is up by 50, 60, 70% over the last couple of years. Auto insurance rates, housing costs, etc. So I think a lot of those types of things that we've been working on are going to continue to be an issue. We have a home care aid crisis. That's been going on. That was on the front page of the New York Times in 1984. 1984. And so I think that as a society, not just New York, we have designed our caring economy going back to 1965 to spend the most money on the most expensive places: hospitals, emergency rooms, nursing homes. where I gave you guys gave you some statistics earlier. I can feed an older adult in their home for an entire year for $1,700. We can keep a nursing home eligible person at home for an entire year for under $10,000 versus 170,000 for nursing homes. So when you talked about the return on investment, there's no question we are the best game in town, and it's trying to incentivize home and community-based services first.
Exactly, exactly. I look at some of these costs and I'm like, wow, okay, that's not a good return on investment. So, and I know you guys, it takes a lot of iterations to do this right. As you mentioned, you've been working on this for quite a while yourself personally, in terms of your career, but also the agency, an ISOFA. I guess one of the things that is a challenge too is how do you sustain, your progress across political and budget cycles? Because I think that's difficult. It's a challenge, because you have new administrations come in, different priorities, then you make gains, and then you have to prevent the next budget cycle from things being cut. So is it just being in a relationship with, with a lot of people over time?
Yeah, Ron, it's a great question. I'm very fortunate. I've worked for four governors, so I've been around. You do have to, with this transition, when Governor Hochul was lieutenant governor, she knew what we did. She came to events. We talked. She understands this stuff. She was a caregiver for her grandfather, so But the political stuff is real. When you do have a new administration coming in, they come in with all their new staff, and you kind of have to start over. Some of the institutional folks, remain. Some of them don't. I think where we're really lucky, Ron, is aging is not political. Never has been, and hopefully it never will be. And I think that what we're able to do is make the business case and back it up with numbers. We talked about the value of the population. All of those things that I talked about, you can verify. You can verify that $70 billion of Social Security is being pumped into the economy, $40 billion in pensions, home ownership rates, right? You can also look at out migration and who's leaving the state. And we want a lot of older people do. We want them to stay. So I think if you're able to make an articulate pitch, back it up with facts, back it up with how we're saving money, but it's also improving people's lives. I think that's really important. We as a society are really good at um, you know extending the lifespan, quantity of life. We're very bad at quality of life.
Yeah, I totally agree. I mean, for me, the two areas that I think we can really think a lot more about. Number one is recognizing that aging is a multi-generational concern. We're all going to get older, but getting people involved at younger ages and understanding where we're all headed in different journeys, but we're all inevitably heading there. So, looking at you know, our yes, overall, our population is getting older. The greater percentage of people are older. I think, what is it, by 2030 or something, that there'll be more people over 65 than under 18, something like that. So recognizing the realities of that, and making this, a multi-generational cultural shift, as opposed to, well, older people are a special population. No, they're not. They're part of all of us, and for me, experiences in caregiving demonstrate that people in younger generations are involved in getting older for their parents and for themselves too. And the other thing is, this is sort of the challenge I think you're constantly facing with, is what's the best role of government, and recognize you can't do everything. So to me, in the future, we need to really think about what makes sense in terms of how the government partners with nonprofits and the profit sector in terms of providing services, and figuring out what's appropriate, what makes sense. So having that sort of team approach, which I think I've heard you talk about, and I've heard your chief of staff, John Cochran, too, talk about this a lot. So I appreciate that perspective. Any further thoughts on that?
Yeah, I think that has to be the approach of, and to your first point, the last I checked, older adults live in families. So you're absolutely right. They're not on the sidelines, not engaged with folks. There's a couple of things I would say. I have never been one to um, be interested in turf issues because there's way too much work to go around. There are things that we as an agency are really good at, and there's things that we don't have the expertise on. So let me give you a couple of examples and why I work with all the other state agencies. We have 59 county offices for the aging. We have 1,420 community based organizations we work with, as well as others outside of what aging does specifically, other associations, could be hospice and palliative care, it could be rural health networks, right? We have to be a kind of an all hands on deck for two reasons. Number one, the how people wind up getting to us is whatever the current crisis is. But that doesn't mean there's a lot more going on. So I like to look at things holistically. But I'll give you an example. We work really close with the Division of Veteran Services because 70% of the state's veterans, 440,000, are over the age of 60, and we have 35,000 on our caseload. We have 29,000 older adults that have a diagnosed mental health issue on our caseload. So we have to work with the Office of Mental Health. I can say the same about substance abuse. Adult Protective Services and Elder Abuse is in the Office of Temporary or Office of Children and Family Services. HEAP and SNAP and other benefits are in the Office of Temporary and Disability Assistance. Obviously, transportation, housing. So, look, there's tons of work to go around. I'm more than happy to share it, but I want to serve people holistically based on what their needs are, so they're not falling through the cracks.
Great, great. So last thing, so how can people find out more about the master plan and about the work that you do in your agency?
So the two easiest things, if you want to look at the master plan report, you could literally just type MPA NYS in your web browser. It'll take you right to the state's page. There's a lot of other things that we offer. We talked about the caregiver, but there's two platforms that are free for anybody in New York State. One is called Get Set Up, and that provides over 6,000 classes, courses, lifelong learning, exercise, etc., but also can teach older people how to better use the tech that they have, an iPad, a smartphone, a computer. We have a one pager on our site. Right there, as soon as you get to our site, aging.ny.gov, that will give you the free stuff we offer. Get Set Up, the virtual senior center, the New York Caregiver Portal, and Archangels. And then, we've implemented 30 more projects from scams and fraud. How you stop it before it happens. So we have a partnership with Silver Shield, with EverSafe. We have things we're doing with tech for serving people with Alzheimer's disease and their caregivers. We have strength training programs to prevent falls and injuries. All of these done technologically, and there's so many more things that we're doing. So our site's a great place to go. Aging.ny.gov master plan. Just type MPA NYS in your browser. It'll take you right to it.
Great. Okay. So last thing is, you mentioned that the master plan is the beginning, not the end. So, are there ways that people can continue participating and contributing in their ideas?
Yeah, so I'm glad you asked that. So the report came out in June. I do a lot of public speaking, and the number one thing that I get right now is nothing's happening with the MPA. I say that is not true. What we don't always do a good job in state government is connecting the dots. There are so many things that were recommended in the MPA that actually have either been done, we're working on, or will be part of the budget. I'll give you a couple of examples. One recommendation was to create an office for older workers. Um, Me and the Department of Labor, we already did that. We did it in September of 24. Um, Expanding initiatives on social isolation. I have a ton of those going. Um, Increasing the number of naturally occurring retirement communities. There's an $8 million budget increase proposed for my agency. Creating a one stop shop for all benefits and entitlements that older adults can access. That was in the state of the state. So I'm just starting to work on that now. Doing more education and training on scams and scam prevention. that was also a state of the state. I could go on and on and on, but it's my job and my counterpart's job to connect the dots. And as we go through, the remainder couple of weeks of the budget, housing was a big part of it. Well, the governor has a $25 billion 5-year housing plan, and there are releases constantly showing where housing that is being opened or ground that is breaking. For your listeners, we're in what's called a home rule state. You can't build housing anywhere in the state without municipal or county governments saying so. So the governor put $50 million in the budget last year and the year before to incentivize municipalities to actually build housing. Because the more housing you have, the more the price is going down. Because if demand is high, the supply is low. That's how prices go up. If you flip that, prices go down. So there's lots of things like that, Ron. And I've been working with the team and many of the other agencies to do a better job of articulating that no, there really is a lot of the implementation is happening. There's going to be some things that, you know, have a large budget ask. Well, that's outside my pay grade. That's the governor's office and the legislature. There's going to be proposals that might need statutory or regulatory change. That might take a little bit longer. So we are not even a year into this, and there's just from the things that I'm really interested in the MPA, there's probably 20 things underway that were recommendations of the MPA.
Well, that's great to know, and I really appreciate it. We packed a lot into this half hour. This will be up on my YouTube 45 Forward website, so people can listen to it afterward. And because I think it's important for me to help you connect the dots, because that is one of the issues, is people just don't know. People ask questions about what about this, what about this. I'm like, well, we have that, we have that. So it's just a continuous a multi-channel approach to getting information to people and helping them out.
Do you mind if I just address that? Because you're right.
Sure.
I've heard over my career, we didn't know that there was an office for the aging in my county. There's one in every county. And I've had people say to me, you guys don't do a good job with outreach at the county level or state level. And I just want to say that that's not true. The fact is that you don't need us until you need us, right?
Mm-hmm. Mm-hmm.
And, two good examples of that is you don't need to know about the star property tax until you buy a home. You don't need to know about TAP or Pell until you're sending your kid to school. So for your listeners out there, you don't have to know everything. You just need to know the one place that you call to get started. If you're in Nassau County, it's the Nassau County Office for Aging. If it's in Suffolk County, it's a Suffolk County Office for Aging. And then if you have listeners across borders, every state has a state unit like mine,
Right.
and they have local offices for the aging. That's the first place you go, because what you want, we don't sell service. We sell objectivity and choice so that the customer and their family can make the best decision possible about their lives. And that's the difference between us and everybody else, is they're trying to sell something. We're not. We're trying to make sure that people get what they need and know what the options are. So, you don't need to remember all the services that we provide. Just remember that there's a county office for aging on Long Island, Nassau and Suffolk, and that's where you start.
Right. And wherever you are, as you mentioned, in the country, there are those offices.
Correct.
So, okay. All right. Well, again, I thank you so much, Greg, for a terrific program, really informative and useful, and hope to have you on again soon.
Thanks, Ron. I would love to be back on, and I really want to thank you for what you're doing. This is really important. Again, people don't know what they don't know, and this is a great way to, get the word out. So I really appreciate you.
Oh, well, you're quite welcome. Okay. Very good. Well, talk to you soon.